I want to mention is I was very impressed by the enthusiasm of everybody who was showing us around from morning to late afternoon, and it really made me, I'm somebody who works on health systems, but it really made me understand that what makes good health systems is the people who work in them and the enthusiasm they bring to their jobs. I'd like to take away from this visit how well stroke care is organized, considering the needs of the population.
The field visit is fabulous, absolutely fabulous. The facilities are quite nice. The application of the multidisciplinary based approaches is increasingly important, I think. It's quite interesting to see that the multi-professional team here consists of traditional practitioners.
It makes me feel understandable of what you're trying to do, is that you're trying to bring traditional medicine to the scientific knowledge of this traditional medicine. So this is the thing that I thought it was the most important part on my learning from this country and what you're doing for the people of Thai.
It was great visiting your diabetes center, which is a center of excellence. Definitely going back home, I've learned a ton about this amazing work and also how you are impacting many lives in Thailand.
The field trip is very important because in the room, in the seminar, we discuss about the theory, about the data, but visiting the fact is the most important thing.
I found it really interesting. I've particularly enjoyed coming to the school here to see the health promoting school where they promote good nutrition and sanitation and knowledge about nutrition and healthy lifestyles with the children. We need to start young, and it's very important that children develop good, healthy lifestyles even when they're already young. Healthy children grow into healthy adults. Unhealthy children tend to have health problems when they grow up.
It is my first time joining the field trip. I thought it was a great experience. Part of the reason why I really wanted to go on the field trip was to get to see really what rural healthcare looks like in Thailand, and I was super impressed. I think the sense of community and the volunteers and the spirit of the village is very evident. It's a model that I think a lot of countries can actually benefit from.
have the step-by-step approaching of the smokers to quit. This is a good example of the cooperation of a private hospital to join the cessation service.
I think the field trip has been quite a success. It's quite an eye-opening in terms of looking at what the hospital has done with regards to their program on tobacco cessation. I think it's commendable, and I think a lot of countries can learn from what is happening here in the Palo Hospital.
The field trip has been fantastic, and it's left me feeling very inspired and very hopeful. Yeah. I'm inspired by the tremendous leadership that's been shown today, and it makes me have hope that there really is progress that can be made in the health system.
And I really enjoyed the field trip today. And last but not least is hospitality. Thank you very much for having me. Thank you, Brad, for inviting me to this field trip.
This field trip is very relevant to the current PMAC conference. And second thing is that I wanted to learn particularly this hospital-based tobacco cessation services, and I exactly what I wanted to do.
What I really appreciate from the bottom of my heart, I would like to say, is the linkage, the community linkage at the household level, the neighborhood level, and at the community gathering level, and also in the community hospital. This together, very attractive, very inspiring, and I wish all the best.
Helping people improve their health and well-being, to show how the community can take a hold of people's health and help them to help themselves through using the community resources and using the links and the join up with the health practice that you have and the elderly school and the home visits. I just think the whole continuity is fantastic.
she is the caregiver that we met at the patient's place, and she informed us that she is voluntarily doing this work, and she's been doing this for 8 years now, and her children take care of her, and she really enjoys being in the community. So what I found very impressive was that she said that the dropout rate of volunteers was absolutely zero, and I think that is one of the major successes of why this program works in this particular community.
I have not seen anywhere in the world how actively you have involved the elderly people. They simply enjoy it and they have better health because of that. I think it is very necessary for other countries also to learn.
I think you are doing a really great job, so keep up the good job on and continue working. It's not easy. We all get tired after some time, and especially with volunteers. I'm sure that after some time they have also a down period, so it's important to motivate them, to show them the appreciation and to let them know that the work they are doing is really great.
I'm really pleased that we're that well received by Thai Health today, and I'm sure that many countries, including my own, so Germany, we can learn a lot from the Thai experience. I think you're really at the edge of what makes good health promotion. That was really interesting, and I thank you for your hospitality.
I think it's been a wonderful visit. The Thai Health people have been extremely hospitable, but perhaps even more importantly, very informative about all the work they're doing, and they're covering the whole span of tobacco control and smoking, of alcohol, of physical exercise, food, all the things that are going to really determine the health of the Thai people.